say whatever you want, but that's what I would suggest.
Do I say hi, everybody? Today's episode is part 2 of a 3-part series all about cochlear implants, and today we're going to be looking in detail at the candidacy process.
Hey everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything and everything audiology.
And if you're not sure what audiology is, make sure to like and subscribe to the channel, hit our notifications bell so you'll get reminded of all of our new content, and we're going to tell you all about it. Okay everybody, today we're talking all about candidacy criteria for cochlear implants. Cochlear implants are such an interesting aspect of our field and what we do, and it gives us an opportunity to work on both the audiological and the surgical side of things. And the cochlear implant candidacy process is where those two worlds kind of collide.
Yeah, so last time we talked about what cochlear implants were, and now we're kind of right in the middle of the series, diving right into that process. And so what we want to talk today about is what happens from the point where you may think you are a candidate all the way up until you get that surgery.
Right. So the first step for any hearing related issue is that we're most likely going to do a hearing assessment. We have to find out from the base, or from the beginning rather, if you meet basic audiological standards or criteria for moving on to that cochlear implant evaluation.
Right, and then from there, if you meet those certain criteria, we actually look at how you're doing in what we call a best aided condition, meaning that in the best possible scenario, so with hearing aids, whether they be your hearing aids or hearing aids that we program based on your hearing needs, we look to see if you're meeting criteria there. So really the question is, are those hearing aids helping you, or are they no longer enough?
Right, and a big part of that candidacy criteria process in looking at the audiogram or the hearing test is what type of cochlear implant would we really be assessing for. You know, the world of cochlear implants has expanded so much that it includes even kind of combination between hearing aid and cochlear implant in one ear. So we're really looking at fine details in what would be best for the patient.
Right, that's a good point too, because I have had people actually disappointed when they do not meet criteria to get an implant. And I always tell people, when we do this evaluation, whether you're a candidate for a cochlear implant or not, what we're looking for really is what your best option is. And so our job is to find out what that option is and then guide you through that process, whether it be a cochlear implant or something else altogether. Okay, so now let's take a look at what that audiological candidacy evaluation really looks like.
Yeah, so one thing that we absolutely have to make certain, and that most insurances will require, especially Medicare, is that a patient is no longer receiving adequate benefit from their hearing aids. And that's the major component of whether or not they're going to be a candidate for a cochlear implant. So one of the main things that we do in testing is make sure that the hearing aids that we're using are verified to be the best fit for the patient. And we use all kinds of different methods to achieve that. But using those hearing aids that we have verified to be appropriate, that's what we'll use to do the testing for candidacy. And largely that testing is based on kind of a real world sampling of speech testing. So during the hearing test, we're saying repeat these words, but during a candidacy evaluation, we want to know sentences. We want to know out of context, what is somebody actually able to understand, both in quiet and sometimes in noise as well. So background noise and things like that. It's much more of a real world example of what type of benefit this patient would get from hearing aids or not get from hearing aids, which will then go to determine whether or not they're a candidate for that next step.
I thought I was going to sneeze. Sorry.
So once we've determined that you are both an audiological candidate to move on to the candidacy process, and then you fit within the cochlear implant candidacy criteria, then we have to figure out the next step for you. And that next step is generally a referral to a physician.
Right. So think of it like the audiologist is going to have all these little check boxes that we have to check off and to make sure that you're an appropriate candidate for this. And if all those check boxes are good, then we're going to send you on to the ear, nose, and throat physician who specializes in cochlear implant surgery. And then they have their own list of criteria that they're going to look at. And really what they're looking at is to see if you are health-wise, if you're a good candidate for that surgery. And they may order other tests such as balance testing. They may order different scans like an MRI or a CT scan, something like that, just to take an overall picture about your health and then structurally what's going on to make sure that, again, you are a candidate for this. So we all have our little check boxes and they have theirs. And then if all those meet up, then you would proceed to have the surgery.
One thing I think is really important to touch on that you had said is balance testing.
Mm-hmm.
Like, what would that have to do with anything? And of course, my ears perk up when you say that, because we do balance or vestibular testing here. And the hearing and the balance organs within your ear are very closely related, and in fact, they share some commonalities. And the process of surgery can really affect your balance in some cases. So we have to make sure that we know which ear has a better balance system, if there is one, which will guide the surgeon in which ear to implant. So that's just kind of an important takeaway.
Okay, so between last episode and today, we've talked about what cochlear implants are, and really took a look at the process from getting your hearing test to see if you're a candidate in that way, and then all the way through the process until you meet candidacy criteria through the audiologist with hearing aids on, and then also with the surgeon medically. So next time we're going to take a look at what happens after you have the implant. So what does that follow-up look like? And we'll dive into that next time.
That's right. If you like what you saw or you liked what you heard, please don't forget to like and subscribe to our channel. Make sure to hit our notifications. And if you have any questions or comments, if you have ideas for future episodes, leave them in the comments or send them to us at info@hearwv.com, or give us a call at the office, 304-428-2403. Thanks, guys.
Thanks.